Welcome back. In late June, Saint Alphonsus Health System announced it was discontinuing obstetrical services in Baker City, meaning the only maternity unit in Baker County might close forever. Abby Davis went to Oregon and talked with community members. Abby, how are they feeling about this decision?
Shira, heartbreak, worry, there are just so many emotions tied to St. Alphonsus' decision. An Oregon Nurse Association spokesperson told me 90% of babies born in that county are born at St. Alphonsus. The hospital says it was a difficult but necessary decision. In a town of roughly 10,000, there's a small but mighty community fighting for moms and babies.
They feel like they have no options, no choices.
Alicia Alderson and her husband Shane are at the forefront of that fight.
Lots of size 1 diapers.
Come late September, they'll become a family of 5.
I'm assuming you both are very excited.
Very,
Very.
But their birth plan and many others got thrown off after St. Alphonsus announced in late June it was closing the maternity unit in Baker City, Oregon. The hospital cited a drop in the number of deliveries over the last 4 years and critical staffing shortages.
The hospital broke the news all at the same time, both to the nurses, doctors, and Oregon Health Authority, the county. So we all were told we had 30 days to try to figure out what we were going to do.
So Shane started working with state lawmakers. In addition to being a dad, he's also Baker County's commission chair. Their efforts already got St. Alphonsus to push the closing date 4 weeks to August 26th. Now they're pushing for another 6 months.
Well, we continue to try to find a permanent solution.
I'm told St. Alphonsus hasn't agreed to the 6-month goal. So if and when maternity services do close, people will have to drive elsewhere. Their 2 closest options, either La Grande, which is about 45 miles away, or Ontario, which is about 75.
One thing I never thought I'd have to consider was whether or not we'd have safe care and a safe delivery. And I just feel like being anywhere further than a few minutes from a hospital is just really scary.
That was crazy.
Local doula Shelley Payton worries most about the winter months. She's the only doula in the county, providing emotional and physical support to expectant moms.
There were many small, quick road closures last year, but there was over 30 large ones, like ones that took many hours before the roads opened again. Not every mom has that time.
Or money.
I suspect that in some cases it will lead to them seeking out less prenatal care because they can't take the time off work or afford the gas money to drive over there.
Community members we interviewed for this story say St. Alphonsus never should have made this decision and believe the hospital isn't being fully transparent.
I think that there's a financial aspect to it that they haven't spoken about.
One of the reasons we know is that it's not local only to St. Alphonsus or only to Baker City.
Kevin Mealy works for the Oregon Nurses Association.
There's been a national trend of hospitals closing birth centers, in part because they aren't money earners.
When new nurses come in and want to be OB nurses, they need a certain amount of training, and it's very difficult for them to get that training in Baker with our low birth numbers. But birth numbers are declining all across the country, and OB has never been a moneymaker, so that needs to not matter.
Does this decision put moms and babies in danger?
I truly believe that it does, yes.
You're going to lose not just the place where the babies are delivered and cared for immediately before and after birth, you're going to lose those other providers who provide essential birth care before and after birth as well.
I asked St. Alphonsus multiple times for an interview. Each time, a spokesperson said they don't have any additional comments. If Baker City can't keep its moms and babies safe, Peyton and Alicia say their town will change completely.
Why would young families want to move here if they plan to have more children?
I think it could literally and figuratively kill our community as far as growth, the care that we need.
Even with all the unknowns and fears, Alicia and Shane say they won't stop fighting for their family.
No, not at all.
And their beloved city.
It's about the public safety and livability of our communities.
Shane, and several Oregon lawmakers are working with the federal government to try and bring in out-of-state nurses. If that happens, the maternity unit could possibly stay open another 6 months. But Mealy says the nurses Baker City already has are leaving, so even that out-of-state option might not be enough to keep the unit afloat. So, Shira, they're still trying to find a long-term solution, and there's just a lot up in the air right now.
Yeah, we've heard about this happening in other places, but geez, you definitely hope that they find that long-term solution.
Yes.
All right, Abby Davis, thank you.